which is, I find very encouraging. So I thank you, Doctor, very, very much. Where is Dr. Wilson? I thank you, Dr. Wilson, very much for that. Thank you.
Senator Dodd.
Well, thank you, Leader. And let me just underscore the points made by Leader Reid and Max Baucus and Dr. Wilson. I suspect if you could only have one organization or group of people to support this bill, the choice we probably make is the one you're hearing today. While it's important to have other organizations be supportive, there's nothing more fundamental when you get right down to this than the relationship between a patient and their doctor. That's at the most fundamental level. Whether or not you have access to that doctor, whether or not you're going to have the resources to be able to compensate that doctor for his or her services. And so of all the organizations and individuals and groups that have supported this bill, I rate this one as the most important because it speaks to that relationship between patients and doctors. There are a number of provisions in this bill. You've heard some of them articulated already by Leader Reid and Max Baucus and Dr. Wilson. One provision that Senator Tom Harkin and I worked on, that Senator Kennedy cared deeply about, was making it possible for young men and women who would desire to become physicians in our country to be able to do so by reducing the tremendous cost. And so the scholarships, the grants, the loans in this bill make it possible for us to increase the workforce. Some estimates are more than 16,000 primary care physicians are needed with the expansion of 31 million people that now will have health care. And so as we expand the numbers of people who will have that kind of coverage, the demands on the providers, particularly physicians, will grow. And so the ability of young men and women who have the strong ambition to be a health care provider needs to be more accessible and less costly. And one of the major provisions coming out of the Health Committee was, in fact, designed to do just that. So on behalf of my colleagues on the Health Committee, particularly Senator Harkin and Senator Mikulski, Senator Murray, Senator Bingaman, particularly those who worked on the workforce issues, this is a very important moment. And we're very grateful to the AMA, particularly to you, Dr. Wilson, for your support of this effort. This is going to make a huge difference in our country.
Senator Harkin.
Well, Dr. Wilson, thank you very much for being here and for your great endorsement of this bill. Some of you may know I was a naval aviator back in the 60s, and we always had naval flight surgeons that took good care of us. And I found out that Dr. Wilson's a former Navy flight surgeon. In fact, we served in the same area of operations in the 1960s. We didn't know each other, but we served in the same area. But as soon as I found that out, I knew we were in good hands. Well, no one knows America's health care system better than doctors. They know the predicament of tens of millions of Americans without health insurance whose injuries and diseases go without proper treatment. They know the predicament of patients who have coverage, but their health insurance company refuses to pay for procedures, or they cancel the policy after they get sick. They know the lives and money that could be saved if we invested more generously in wellness and disease prevention. And I thank you, Dr. Wilson, for pointing that out. So I welcome the support of the American Medical Association. America's doctors have sized up our broken health care system, and their prescription for a cure is to pass the Patient Protection and Affordable Care Act. Specifically, with regard to doctors, I want to emphasize that this bill will enhance the doctor-patient relationship in many ways. For example, by cracking down on health insurance company abuses, we're going to reduce the opportunities for corporate bureaucrats to come between the doctor and the doctor's patient. This bill will reduce administrative requirements and paperwork, again, freeing up doctors to practice medicine and to focus on their patients rather than on paperwork. This bill will significantly increase the number of primary care doctors, especially in rural areas and other underserved communities. We do this by greatly expanding the presence of community health centers and increasing investments in the National Health Service Corps. We also create a rural health care professional pipeline, which give increased training opportunities to health professionals working in rural areas. And I can't emphasize enough how revolutionary it's going to be to transition from our current sick care system to a true health care system, one that focuses on preventing chronic disease and keeping people out of the hospital in the first place. That's what doctors want to do, help people stay healthy. And now these preventive services will be paid for. So again, I welcome the AMA support. America's doctors have made the right diagnosis, and they've offered the right prescription. pass the health care reform bill.
We'll take a few questions.
Clearly, you have cited a bunch of associations, AMA, as backing your legislation. The Republicans say, however, you don't have the support of the public. A few hours ago, Michael Steele accused Democrats, and I'm quoting him, of flipping the bird at the American people. Do you worry about political fallout from passing this?
Well, I'm more worried about an example being set by a party leader with something so obscene. I think that's something people should be worried about. If you look at the morning polls today, there are some polls that show, just as a result of our passing this, the support of this bill is up about 10% just overnight. The American people, once they have the information, will be totally supportive of this bill. Think of the examples that I gave on the floor last night. A boy by the name of Caleb, doctor, in Nevada. He was born with legs that only went just above his knees. Since he was 5 years old, the insurance company will not give him prosthetics. That's what this is all about. It's about physicians like Dr. Wilson being able to take care of people like Caleb. So I'm disappointed that someone as with the title that Mr. Steele has would be so crass and such a terrible example for the youth of this country.
Senator Reid,
Yes.
Could you address concerns that the bill is chock full of pet projects for even some of you standing up there that were designed to benefit your states and also perhaps to secure the votes of wavering Democrats? And Senator Dodd, would you mind address the question
I'm happy to respond.
University of Connecticut
I'm happy to respond to this. We just completed a bill, $600 billion for the defense of this country. You all know how difficult it was to pass that. One way we were able to do that piece of legislation is we had to do a number of different compromises. As you know, that dealt with extending the safety net, food stamps. We weren't able to put the child tax credit in there because senators didn't want that. That's what legislation is all about. It's the art of compromise. In this great country of ours, Nevada has many different problems than does New Hampshire. Michigan has many different problems than does Georgia. We have wide ranges of different needs throughout regions of this country. Some of those are basic health care delivery problems. Others are because of the unemployment situation. So this legislation is no different than the defense bill we just spent. We just spent $600 billion on. It's no different than other pieces of legislation that are big, large pieces and small pieces of legislation. We work to compromise. There's 100 senators here. And I don't know if there's a senator that doesn't have something in this bill that was important to them. And if they don't have something in it important to them, then it doesn't speak well of them. That's what this legislation is all about. It's the art of compromise. Chris?
Well, just very briefly, and I talking about the grant program for construction. There are roughly 14 states that would qualify for that grant program, Connecticut being one, along with 13, I'm told, of 13 other states. It's a grant to be determined by the Secretary of Health and Human Services. It's not an earmark. It will be competitive as to whether or not states, if they decide to compete for those grants, will get them. But it's completely competitive. And again, it doesn't involve just my state, although my state is very interested in a proposal for reconstructing the the John Dempsey Medical Center at the University of Connecticut. And so I crafted the language of it and wrote it in such a way that it would include far more than just my state, would make sure it was competitive, to be determined by the secretary, whoever makes those decisions, on a competitive basis. Okay?
One more question?
Senator, can you talk a bit about the situation heading into conference with the House now that this does seem likely headed for passage?
Well, first of all, let me say this. We have to pass this bill in the Senate first, and that is our direction. That is our guiding light. And we'll worry about next steps at a later time. We're going to finish this bill before Christmas. We're committed to doing that, and we'll worry about the next steps at a later time. Right now, we're focused on what we're going to do this week.
Senator Reid, just to follow up on a previous question, can you explain why is it fair for Nebraska in particular to get the expanded coverage on the Medicaid costs paid for by the federal government, especially when other states like your own have
let me just say
problems.
this. Let me just say this. Medicaid is a difficult issue, and you will see in this bill different treatments of Medicaid. Why? Same reason I said earlier. Nevada has we probably are the lowest health insurance state in the country. We have some needs that other places don't have. We have problems dealing with primary care physicians. We have problems with Medicaid because of the low contribution rate we have. So